Well, a new study warns of sweeping foreign aid cuts are set to plummet international health funding to its lowest level in 15 years. The report published in The Lancet says the decline is driven by cuts in the U.S. The cuts slashed funding by at least 67% this year. It also points to recent cuts announced by the U.K., France, and Germany. The study says sub-Saharan African countries like Somalia, the Democratic Republic of Congo, and Malawi will be the worst hit. It says the cuts have a major impact on treatment and prevention of a range of diseases, including HIV and AIDS. A separate Lancet study earlier this month estimated the cuts alone could result in preventable deaths of over 14 million people by the year 2030. Now, for more on this, I am joined by Dr. Samir Gupta. He's a respirologist and associate professor in the Department of Medicine at the University of Toronto. Good morning. Good to have you here.
Good to see
the
you.
fact that these are going to be programs that'll be affected, 15-year lows, just on the sort of surface of this, and we'll dig into a little bit further, but what's your reaction to how human health and prevention will really be impacted?
Yeah, it's such a shame, and this has been happening for months now with the USAID cuts, and it's been publicized, and, Musk walking around with a chainsaw, and it's, people have made light of it, but these programs are so impactful. We talked about some of the numbers and what the USAID does. I mean, this organization has been so successful in countries around the world, over 100 countries that it helps. And it's maternal and child health, it's reproductive health, family planning, it's controlling diseases like malaria, TB. It's just building up health systems. It's building up vaccination systems. So when you lose all that, you weaken health systems, and that has major future impacts for generations. You create the conditions for global disease outbreaks, and again, that comes back to us. You also cost lives immediately, and some of the numbers you talked about are staggering in terms of how many people will die as a result of this. And then you also affect science and innovation, because people forget that USAID and some of these other programs, they actually fund a lot of research, and that research is knowledge that's globally relevant.
Well, I want to talk about the science and the research, because that is a critical part for our learning around the world. But let's focus in on the idea of the impacts and how it has a knock-on effect. So it's not just about sub-Saharan Africa, but there's a potential that we see and feel it here in Canada.
Yeah, so when you think about this investment, you're investing in, you're doing the right thing, the moral imperative, you're saving lives, but what are the benefits for Canadians if you have to ask that question? First of all, just infectious diseases. We've learned, obviously with the pandemic, but even after the pandemic, with monkeypox, with Ebola, we've learned that these diseases eventually make their way back to our shores. If you have these diseases running rampant in other parts of the world, you're creating the conditions for the kinds of mutations that make these diseases harder to then treat and control, and that affects us. When you talk about science and innovation, when you're doing a study in Africa and you're learning about tuberculosis, that's going to help us. That helps the whole world in understanding how this disease works, how best to treat this disease. And that's where, the part that's just so wasteful, it's just so hard, it's disheartening, because you might have a 5-year study that you've already invested $4 or $5 million in. There's 1 year left, and they've gone and cut to save $1 million. They've gone and cut it. We'll never see the conclusion. We'll never learn what we wanted to learn out of that study. And you've wasted $4 or $5 million to save $1 million. And similarly with medications. There are medications, millions of dollars of medications rotting away in warehouses in Africa because they've already invested in the medicines, and they came in and cut the investment in the distribution force. So that's where the waste component is just so challenging.
And you talk about and you lay it out perfectly of why this matters, from, the health impacts on the ground to the research to us not having the benefit of that local research, because we know diseases don't have borders anymore. Right. There's so much travel. We saw this most, notably during the pandemic, when we all sort of felt it. When you're looking at these sort of things from a medical point of view, you saw it on your face a little bit. You have this pain of we're making poor decisions to save a little bit of money now versus the gains a year, 6 months down the road.
Yeah. I have to say, it's staggering what they've achieved. And the flip side of that is when you cut something so successful, it's staggering what the cost is in terms of human lives. And so this report from the Lancet, and you presented some of the numbers, but they found that between 2000 and 2021, USAID alone had saved 91 million lives. 31 million of those were kids under 5. That is just such a monumental achievement. And the flip side is now with these cuts, as you said, in the next 5 years, it's 14 million lives that would have been saved that won't be. And that includes 4.5 million kids. So very impactful, very successful. And then when you cut it, all of that impact and cost. And how much can other countries do to make up for this? Well, we're hearing that some European countries are actually cutting. Canada's around stable, but when you think about investment, if you think about something like a malaria program that USAID had maybe invested $20 million in, they had the field force, they had the infrastructure. Canada would tag on and say, hey, here's $5 million, let's increase the scope. We couldn't have done this alone, but we can improve what you're doing or increase what you're doing. We can't, that $5 million just doesn't go as far without the larger investment that you're tagging onto. The other thing is, where does that money go? We actually don't know where some of that co-investment is going to go. Will we get it back? Will it just be sort of lost into the ether of these cuts? That's an unknown. So there's waste happening in terms of US dollars, but there's questions around where all the co-investment is going to go and whether other countries like ours are going to get that money back to be able to reinvest. We don't know.
Because those are often, large sums of money,
Yes.
small in the terms of when you pull everyone together, but individually they do make a big difference. As you mentioned, there's no suggestion that Canada is going to change its funding, but without the larger chunk from USAID, it does have an impact there. So what can be done? Is this a matter of the WHO sort of sounding an alarm saying, hey, we need to do this and here's why, or what's the next step in this?
Yeah, I mean, I think the alarms have been sounded, and it's good that we're talking about it, and the people in high-income countries are more and more aware that it's beyond the moral imperative, it's beyond saving lives, it's the right thing to do, it's soft power, there are political reasons to do it. All of those arguments are being made, but ultimately it's the dollars, and I think it will be hard for the world to step up and fill that massive gap left by what has happened in the U.S. with USAID, Elon Musk, and all of these other cuts. And we're actually seeing the opposite. We're seeing other countries, these major European countries, kind of taking the opportunity to say, well, maybe we don't have to do this either if the U.S. is not doing this, rather than saying we're going to step up and try to make up some of that gap. So we're seeing a real change politically, partly because, in terms of what's happening economically in these countries with interest rates, et cetera, but people are finding reasons to say, well, maybe we can get away without doing this. And the consequences will be felt for decades to come.
And we will no doubt be talking about them, in months and weeks ahead. Dr. Gupta, always good to see you. Thank you.
You too. Thank you.